Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, everyone. Welcome to this masterclass on pain education for the healthcare professional. I'm Dr. Joe Tatta, and joining me today is one of our newest faculty members, Dr. Carey Rothschild, who's going to talk to you all about the importance of pain science and pain education in practice, whether you're a physical medicine or a mental health professional. Let me, of course, first introduce Carey to all of you. So Dr. Carey Rothschild is an assistant professor in the Doctorate of Physical Therapy program at the University of Central Florida. In addition to earning her DPT, she's board certified in orthopedic physical therapy and in sports physical therapy, and earned a certificate of achievement in pelvic physical therapy. Her research related to running and the female athlete has been published in the Strength and Conditioning Journal, the Journal of Strength and Conditioning Research, Sports Health, and the Journal of Women's Health Physical Therapy. In 2019, Carey received the award for excellence in academic teaching from the Florida Physical Therapy Association. And a big part in her earning that award was for her innovation in developing and teaching a course on pain science, pain education, and pain rehabilitation to both physical therapy students and even some other healthcare professionals like social workers down at the University of Central Florida. So I am super excited to be sharing this masterclass with you. Carey's got lots of great information with regard to pain education. Carey, I think the best place to start for those that are wondering and curious about pain education is really, what is pain education? How do you define it?
Hi, Joe. Thanks so much for having me. I'm really excited to be here talking to you about pain education. For me, I think the definition is twofold. I think the healthcare provider first needs to become educated about pain themselves as a practitioner. And that would include the basics, the neurobiology of pain, the mechanisms of pain, and that multidimensional nature of pain. So I think it's twofold. So that piece first, and then what a lot of practitioners might be familiar with is the healthcare provider taking this education to the patient or the client that they might be seeing who has persistent pain. I know many practitioners listening to this podcast are probably familiar with pain neuroscience education or explain pain or anything similar. And those metaphors and analogies are super helpful to educate the person who is having pain. But I think that pain education goes beyond just that piece, and it also incorporates that multidimensional aspect of treatment that includes both physical and cognitive type of therapies that will be beneficial for the comprehensive care of the patient who has pain.
Excellent. I think that multidimensional perspective is really what is driving professionals right now. It's really what they're looking for. How do I treat this multidimensional problem that is in my clinic every day? How does a professional start to weave pain education into their clinical practice? I think when I teach courses, one of the first questions is, do I need extra time? Do I have to rearrange my entire schedule? How does this seamlessly work itself in?
That is a great question. I think once the healthcare provider is feeling comfortable with their knowledge of pain and the multidimensional nature of pain and all the things that contribute to the pain experience, I really think this educational piece starts right with the examination of the client or the patient, right at that first visit. I think it involves asking the right questions and really spending time on developing that therapeutic alliance, really understanding what the patient's expectations are for the healthcare session with that provider, and really developing that mutual respect and really coming to some collaborative, realistic goal setting. So I think that really is how we start to integrate it. Then, of course, the practitioner can use those metaphors and analogies in explain pain to kind of help the patient understand what it is that's happening to their body, their nervous system, and why they're experiencing things that they're experiencing. And then follow that up with that multidimensional aspect of treatment. That's going to include not just that educational piece, but kind of weaving it into if you're just talking with the patient and kind of giving them advice on how to start moving in a pain-free, not pain-free, but in a less fearful type of environment. And then also discussing those lifestyle factors that have the influence. Sometimes it might just be bringing that alarm system down a little bit by alleviating some stress, including those psychological interventions like cognitive behavioral therapy and acceptance and commitment therapies, and teaching some coping skills and some breathing activities. And then, of course, supplementing with the other integrative management of pain with the different practitioners that can assist with the physical treatments. Physical therapists can administer modalities, and massage therapists can do manual therapy, and manual therapists can do those types of things as well. So I would say, to answer that question, I think it really, there's multiple avenues for where that pain education assists the professional in managing the patient with pain.
As I'm listening to you, so you've mentioned physical therapists, you've mentioned cognitive behavioral therapy and ACT, which you think of a mental health professional. You already mentioned a massage professional. Mm-hmm. So it sounds like this course that you're about to launch really is appropriate for all healthcare professionals, and pain education is not just for the physical therapist, but it's for every health professional.
I would definitely agree. And in my experience down here at the University of Central Florida, we've been doing some interprofessional events, and we've had this team, as you mentioned during my bio, where we are having our students integrate with the medical students, the nursing students, the pharmacy students, and the social work and counseling education students. And so we have our students all collaboratively working together to treat a patient with chronic low back pain. And so it's a really neat way to see how all professions can benefit from this pain education.
Excellent. I know you have a case study you're going to talk about, a 45-year-old female who has chronic pelvic pain and low back pain. But before we get to that case study, all therapists, all professionals are always concerned about, how do I bill for this? Mm-hmm. What do I do? I'm in the clinic now, of course. There are demands on me, productivity demands. Some of that relates to bringing income into the facility. How can you bill for pain education?
Well, I think it's a multitude of ways. If you're doing education, again, if we kind of have this big overarching umbrella of pain education, that's the practitioner's knowledge about pain. So if you're understanding more how the pain system works and you're trying to retrain movement, that may, for a physical therapist, fall into therapeutic activities, therapeutic exercise. But it does fall in very nicely and doesn't really take extra time, because a lot of the things that you're doing with the patient is the talking part, but while they're doing something that's beneficial. For physical therapists particularly, we already educate and counsel patients on body mechanics, on pain management strategies at home, and self-care types of things. So, if we work in a practice setting where you have more time, if you're in a setting where maybe it's a cash-based pay format, you might have more time to do these types of things. But it really depends on the setting, I think, that you work in. But you don't really need extra time, because it should fall right into some of the interventions that you would probably already be doing as part of your healthcare practice.
Excellent. You also, earlier in our little chat here, you mentioned pain neuroscience education and explain pain. Mm-hmm. Professionals are familiar with those as different types of pain education approaches, really more for taking that and working with the patient. Mm-hmm. How does this course, pain education for the healthcare professional, differ from those?
That is a great question. I think there's two main points on how this is different. Pain neuroscience education and explain pain is a component, I think, of the overall pain education experience for a healthcare provider. So number one, I think this will help the healthcare provider be better able to accurately assess patients that are having pain, and most likely persistent pain. I think that begins with understanding some basics of pain neurobiology and really recognizing a lot of the different individual variability factors that play into the patient's pain experience. I also plan to implement the most recent evidence-based outcome measures that are utilized for assessing and looking for change in the patient's overall pain report as well as function. And some of those outcome measures can be used to assess the level of fear in a person or the level of catastrophizing that might be present with an individual. And then really there's a good chunk of the time is spent on how you can maximize the patient and provider therapeutic alliance. And that's what I think some educators have termed as soft skills. And I think once you get those soft skills developed as a healthcare provider, that is something that really can take you a long way and achieve better outcomes with your patients. The second point then is really not just the assessment, but also the management. And I know I've alluded to that multidimensional aspect or that integrative management of the pain experience, but that does include the pain neuroscience education. But pain neuroscience education alone is, the research says, is not the only thing that you should be doing. And so we must incorporate movement. We must incorporate maybe modalities or other adjunctive types of therapies like acupuncture, of course, manual therapies, soft tissue massage and mobilization and joint manipulations. And then additionally, the lifestyle management, which I know you've had a lot of wonderful people on here to talk about that, and really having chats with your patients about their diet, about their sleep, about their stress management, and then maybe directing them to a healthcare provider that is expert in psychological interventions that can help patients learn coping skills and maybe mindfulness and meditation and some of those other psychological interventions. So I think this course is definitely comprehensive, and it really takes you from the most beneficial evidence-based assessment. And so you can better do that when you have the knowledge base, and then taking that, better defining the mechanism behind the patient's pain, and then really drive the right treatments that are multidimensional in nature.
I love that. So learning how to assess pain, learning how to identify the mechanisms and leverage those mechanisms for treatment, and then obviously which treatment to apply. And that's key, rather than just applying metaphors or just, a certain exercise, so to speak. So in essence, what you've done is you have turned pain education into personalized pain education, which is really important, because everyone's pain is unique. And that's what this course helps you figure out and helps you solve with people. Okay, let's turn toward the case study. I know you have a case study that you want to share with us. It's a 45-year-old female with chronic pelvic pain and low back pain.
Yes. This client came to see me for physical therapy services. She had 2 young children at home. So she had pregnancies twice, and they were both delivered via cesarean section. So she had told me she had pain for about 5 years. Her children were now 5 and 2. So kind of correlating with the pregnancy, correlating with the delivery. And she came to see me, and she just kind of had generalized pain. She had the general low back pain, the general abdominal and pelvic pain. She was really concerned because she had gained weight. She was also recently diagnosed with depression. She was taking medication. She had come to see me after she had visited some other practitioners that hadn't really been able to help her. She was anxious to get back to doing some exercise. She wanted to keep up with her kids, and she felt like she was having a hard time just walking the dog. And so, thinking about all those different avenues that this patient has been in, as a physical therapist, maybe using a biomedical model, I may have focused on what's happening to the low back, what's happening to the abdomen and the pelvic region, and then really kind of zoned in on maybe the core strength or maybe the flexibility as a physical therapist might do. But we spent the first session probably doing mostly talking and really building that therapeutic alliance. And so some of the things that I'll be speaking about in this course have to do with those initial examination questions that you'll have for a patient, and giving that patient some validation that she has a stressful life. She has 2 children that she's trying to raise, and she's also had a recent diagnosis of depression. So we know that using that biopsychosocial approach, we have to consider, yes, the biology, and then on the psychosocial piece, we had to consider that she did have some depression, and she did have a lot of stress with one of her children was diagnosed with ADHD. And so you keep pulling all of these elements out of what's happening at home. And, I recently listened to a podcast, and they used the term life load. And I thought that was really good. And I said, wow, you have a lot of life load going on. And, what if you were to imagine yourself in a beach with your husband, relaxed, with no kids and nothing going on? Do you think your pain might be lower? And she's like, well, yes, we actually did take a little trip for anniversary. And I said, did you have any pain that weekend? And she said, no, not really. And I said, well, and then we kind of used some metaphors and analogies, incorporated the pain neuroscience education. And then, of course, we looked at the biology, and she did, in fact, have a diastasis recti abdominis. So there was some definitely separation of the abdominal muscles. She really wanted to go back to doing some yoga, and she was really concerned about that. She really disliked her appearance of her abdomen, and she really was focused on almost, it wasn't even a part of her body. And some of the treatments that we can do in terms of getting back to movement is just kind of bringing that body part like back into the brain and kind of recognizing that that body part is part of her. And so one of the strategies I had her do is I had her get, like catalog, and I like a little mailer of bathing suits. And I said, I want you to circle a bunch of stomachs, and I want you to recognize that those stomachs are great. I'm like, your stomach has held babies, and your stomach has, really prepared for these wonderful boys that you have. And she did it. And she came back and she's like, I feel better about my stomach. And I just would never have even thought about that had I not realized some of the neurobiology and how our brain almost disconnects from the body part that is experiencing the pain. So she was totally fascinated. And we just had these little elements right at the beginning that she definitely bought in, and we made these goals together, and she wanted to walk a certain distance, and she wanted to be able to do certain things with her kids and get back to yoga. But we kind of brought that abdomen back in, and then she did have some scarring and things like that. So we worked on the biology, and we improved the tissue mobility of her scars. And then we started her moving. And I think she really did great. And these were skills that I definitely did not learn in my entry-level degree. And having gone to lots of different continuing education courses and having developed this type of course, I think will provide a practitioner to kind of have all these different options and treatments that go beyond just let's do some crunches or pelvic tilts, or let's do some forward bending and some yoga stretches. I mean, we did get her to that point, and she was very happy with her outcomes, and she did achieve the goals. But I do think that ultimately the time that we spent right at the beginning and pulling out all those factors, even giving her some strategies for breathing, when she felt some stress come on, and some strategies for coping, and some distractive kind of techniques that I definitely did not learn in my entry-level degree. So that's a little snapshot of the patient. Thankfully, there was some education that was able to be used from a pain science perspective, but it was really the multitude of all the different multidimensional treatments that we were able to use to really get her to achieve her realistic goals.
I love the way you folded all that together, because I realized that it takes a special practitioner, and it also takes education and practice to be able to talk about it the way you just did. Because I know there are people out there who are thinking, wait, what did she do? And when did she do it? And how did she do it? And but
yes.
I think the real sign of a skilled clinician is really what you just said. It's just kind of innate to you. Like, yes, there's all these pieces, but you've learned how to fold this in a way that is easy for clinical practice, and obviously helps the patient get better. So I really appreciate that.
Thank you.
All of you can, of course, register now for Carey's course. It's called Pain Education for the Healthcare Professional. You can click the link below, or you can go to the Integrative Pain Science Institute.com, scroll over to the courses tab, and then scroll down through the courses, and you'll find Pain Education for the Healthcare Professional there. It's worth 7 CEUs/CEs. The Institute, as you know, is approved for physical therapists, CEUs, OTs, health coaches, and the Institute is approved by the American Psychological Association for CEs for psychologists. So approved for mental health providers also. And I know there's tons of mental health providers that follow my work on the podcast, and I highly encourage you to take this course, because oftentimes pain education is the one thing that's missing from a CBT or an ACT approach. So if you're a mental health provider and you feel like that was missing from your training in school, this is the course to take. And then, Carey, can you just give us a rundown of the course and what people can expect each week?
Absolutely. And Joe, I think you hit the nail on the head. This is really the course to get the practitioner up to speed with what is the International Association for the Study of Pain's goals for various healthcare providers. There are curriculum out there established by the IASP. And so this really, this course kind of follows some of those basic objectives that are really the goal for practitioners treating, the modern practitioner treating patients with pain. So week one, we're going to have a crash course on pain neurobiology, kind of learn about the multidimensional nature of pain, the peripheral and central pathways, and be familiar with those key three mechanisms of pain. Week two, we talk about the individual differences and the variability that may be related to sex and gender and personality. We'll also look at some of the evidence-based outcome measures that can be used for the pain assessment, both subjective type of scales, pain-specific scales, as well as some psychological questionnaires. And then in week three, we start to get into some of the management of pain, but really focusing on those soft skills development, really incorporating and understanding how patient expectations and patient preferences play into the whole outcome. And then really some good skills on developing that pain, that positive therapeutic alliance between the provider and the patient. And then we also will be going over basic pain neuroscience education, sharing lots of different resources for those that want to educate the patient about pain. So various mechanisms of metaphors and analogies, and really learning how and when to use that type of education, because the patient really needs to be ready to receive that education before you just start speaking at them. We'll do a little review of some of the exercise and movement-based therapy, as well as some adjunctive modalities that can be helpful for pain management. And then we'll talk about some of those integrative factors that include lifestyle things. So we'll talk about some sleep hygiene. These are some great things that can be added into a treatment plan for a patient with pain. Some nutrition, which, Joe, I know you've had lots of folks on here to learn about nutrition. And then we'll also incorporate some case studies, that typical patients that do have persistent pain. And then we'll wrap things up at the end with some of those psychological approaches to pain management, including cognitive behavioral therapy, acceptance and commitment therapy, and then just some coping strategies, including breathing and mindfulness and relaxation, and really helping practitioners to really deliver a psychologically informed approach to managing patients in pain. So that is it.
Excellent. So if you've taken a course at the Institute before, you'll hear that this really aligns well with some of the previous courses you've taken. And especially if the latest on pain science and pain education, the assessment and treatment of pain is missing from your skill set, then this is the course to take. So once again, you can find it by going to the Integrative Pain Science Institute.com, scrolling over to courses, or if you're on the landing page here, you can just click on the link below and it'll take you right to the registration page. I want to thank Dr. Carey Rothschild for being with us today and giving this great masterclass on pain science education. The course is open now. It'll be open for the approximately 7 days, and then registration will close. So we urge you to sign up for this first cohort. We already have a number of people registered, and we're very excited to see you in the course and to work with you.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.